International Malaria Day was marked on April 25th. The fight against malaria in Africa is always ongoing. In Focus Health correspondent Linord Moudou now joins us. You want to tell us more about that battle?
Thank you, Vincent. Efforts to combat malaria in Zanzibar have seen the rate of infection come down from 35% before 2008 to below 1% today. Zanzibar Malaria Control Program interventions include the training of health workers and indoor spraying against mosquitoes. But health officials are worried the gains could be reversed, partly due to a lack of funds for prevention. And there is more encouraging news about malaria from Malawi, where researchers say there has been a 45% decrease in childhood malaria cases. Malawi's anti-malaria campaign includes spraying insecticide on indoor walls to kill mosquitoes, as well as distribution of free mosquito nets. The government also delivered a national supply of artemisinin-based combination drugs, the treatment declared most effective in fighting malaria by the World Health Organization. Dr. Terry Taylor is head of the Blantyre Malaria Project in Malawi.
Malaria Alert Center, together with the U.S. Centers for Disease Control, have been looking at which drugs are the best. And so Malawi, in fact, was ahead of the rest of Africa in stopping the use of chloroquine. The Ministry of Health realized and acted early on advice that chloroquine was no longer effective, and we moved to fancy.
Meanwhile, Mozambique's Ministry of Health is increasing efforts to reduce the number of malaria cases in the country.
Bonita Gomez's life hangs in the balance. Her frail body has been attacked by malaria, and the 3-year-old is in a coma. Her mother took her 30 kilometers on a motorbike to the nearest health post in the middle of the night. A rapid blood test indicated she had severe malaria with complications.
There is no doubt that malaria represents a significant health burden in the province of Tete because it remains the first cause of consultation, first cause of hospitalization, and first cause of mortality, particularly amongst children aged between 0 and 5 years old.
In Mozambique, 1/3 of all children die from malaria, and it's the largest single killer of children under the age of 5. In Tete Province's newly renovated hospital, the outpatient ward is busy. The small lab does 60 to 70 blood tests a day. The Ministry of Health has adopted a more aggressive strategy to combat malaria with support from partners such as the European Union, UNICEF, and the Global Fund.
We as the European Commission think that prevention, especially of malaria, is important. It's feasible if people understand how serious the illness is, and then understand that by sleeping under a mosquito net they can prevent becoming ill and thus prevent costs to the family, death of a child, death of a pregnant woman.
Mozambique's malaria strategy is producing results. Health officials say in the last year alone in Tete Province, the number of cases has dropped by almost 70% and malaria death by almost 90%.
Some very encouraging news there. Vincent, back to you.
Yes, thank you very much. We always want to know that the fight against malaria is being won.